report you to. All right, so let us begin. We're doing rheumatology. There's a 24-year-old Sir John in accident emergency. Your time starts 1, 2, 3 now.
Hello.
Hello.
Hello, I'm Umar, one of the doctor in in emergency department. May I have your name and age, please?
Yes, doctor. My name is Sir John, and I'm 24 years old.
Okay. How can I call you?
Well, you can call me sir.
Okay, that's perfect. How can I help you, sir, today?
Well, doctor, I've been having a really bad pain in both my shoulders, and it's been there for around almost like 2-3 months now, but I was ignoring it. Now it's getting really bad, so I thought that I should come and see you.
Okay. So it's quite a long time you have this one. So how you are coping with this out?
Well, doctor, I was taking some paracetamol initially, and previously it wasn't much, but now it's been like a lot. It's a lot of pain.
Okay. Are you comfortable to talk with me at the moment?
Oh, yeah. I think quite
Okay,
okay to talk about.
That's perfect. Okay. Anything make it your pain worse?
But yes, doctor, I mean the shoulder pain, it's just there almost, and it's kind of stiff. I do feel a little tired as well. So,
okay.
Yeah.
And beside this one, is this pain is in a specific part of the day, or is it's present all the day?
No, it's just there all the day.
Okay. Can you score your pain for me from 1 to 10? The 1 is the low pain and 10 is the worst pain.
It's around 6 or 7.
Okay. And as you mentioned about the stiffness, so it's along with the pain, or it's comes and going?
No, it's just there. It's along with the pain. I mean, first it's kind of stiff, then there's pain in my shoulders and, also hips.
Okay. Have you experienced this kind of the pain any other part of the joint, like knee joint or any other joint?
No, doctor, no. But I do have pain in like this cheek, right? Sometimes it hurts. Yeah.
Okay. Besides this one, you have any vision problem?
No, doctor, no.
Any problem in the vision loop?
In the what?
In urination?
No.
Okay. Have you experienced any rash on your body?
No, doctor, no.
By any chance, you lost your weight recently?
No.
Hello?
No, doctor, no.
Okay. Have you experienced this kind of condition in the past?
No, doctor, this is the first time.
Okay. Are you diagnosed with any medical condition like high blood pressure or high blood sugar level?
Yes, I've been diagnosed with hypertension, and that's just it. Yeah.
Okay. Are you regular to your GP?
Yes, I am.
Okay. Okay. Besides this one, any thyroid problem you have?
No, doctor.
Okay. Anyone in the family have any medical condition you wanted to mention?
No, doctor.
Okay. And by any chance, besides the hypertension medication, you are taking any other medications?
No, nothing like that.
Okay.
But I don't take these medications all the time. Like sometimes I take them, sometimes I don't take them. Recently
Okay.
I'm not taking them. I don't like taking them.
Is there any particular reason behind that why you are not taking?
Well, I don't have anyone at home, so it's difficult for me to, there's no one to remind me that I should take them.
Okay. Okay. Sorry, I just wanted to ask you a question related to your lifestyle. Do you smoke?
No, I don't smoke.
Okay. How about alcohol?
No, I do not drink.
Okay, that's really quite reassuring. And what you do for a living?
Well,
Hello?
I am a writer, I write, and this is why, this pain is a problem for me because
Yeah,
according to
definitely.
I'm a writer, and this is why this pain is a big problem for me. Yeah.
I can understand it must like affecting your work, right?
Yes, doctor, it is very much.
Okay. Sir, can you score your mood for me from 1 to 10? The 1 is a low mood and 10 is a good mood.
Well, I think it's all right.
Okay. Okay, sir. You told me about that you are living alone. So, is there any difficulty to coping your day-to-day activities due to this pain?
Yes, doctor, it's quite difficult for me to move about and like do things. So yes, there is lots of problem in that area.
Okay. And beside one, do you anything I miss you wanted to tell me here?
No, doctor, but every time like I'm chewing, I do have pain at that time too.
Okay. Okay. Okay, thank you very much, sir, for giving me the answers of my question. Right now, what I'm going to do, I would like to check your observation, which include your blood pressure, respiratory rate, and level of oxygen. I would like to do examination, especially your examination of your shoulder, and I will do some specific tests. Okay, is this okay for you?
Yes, doctor, that sounds fine.
Okay, and I would like to run some basic tests, which include your complete blood count, liver function, kidney function test, and inflammatory marker. Okay. Okay, sir, do you have any particular expectation from today's consultation?
Well, I just want to get better. His ESR is high and CRP is also high.
Okay, definitely. We're here to help you. Okay, from what I gathered from you and after the examination, and also we did the blood investigation, and some inflammatory markers are high, and we're suspecting you have a condition which we call polymyalgia rheumatica. Are you with me?
Yeah, I'm here, but what did you just say? Can you say that again? What is it?
Okay, I know it's a bigger term. Let me explain to you. Basically, it is an autoimmune condition in which our body cells affecting our own, attacking our own body, and it is inflammation of the muscles, especially the shoulder joint, or sometimes the patient have a hip joint. So that's why you got this pain. We are on the same page.
Okay, you said it's an autoimmune condition. All right, and what are we going to do about it right now? Like,
Right now, what we're going to
I,
do, I will inform my seniors, and they might do some specific tests, and we might refer you to the specialist to confirm the diagnosis and start the treatment. Okay.
all right, okay.
Okay. Meanwhile, I will give you the painkillers as you are in pain. So we will give you the painkiller, and we might refer you to the physiotherapist that will help you.
All right, Dr. Umar, the time's up.
Okay.
So how did you do?
Oh no, I was confused.
Why?
I think I'm taking more. I took more time on history. That's why.
Okay, so did you know what the person had? Like just from the beginning?
I Yeah, because actually you were giving two hints, because like before I thought it's a polymyalgia rheumatica, and then you were saying that the pain in chewing, that was, so I was a bit confused at that place.
Yeah, so PMR and GCA can happen together, like they go hand in hand, no?
Yeah, so that's why, and I was a little confused because if there is a pain in chewing, so we have to be like urgent refer to the patient.
Yeah, so that is right. You have to urgently refer them, but like let's start from the very beginning, right? I'm also practicing. We just started, right? So all this is of what I have learned from Dr. Mo, and like from the practice that we've been doing. So, when you asked with the pain history, right, I just told you that I've got pain in my shoulders. When I was done, you were supposed to ask which shoulders, right? Like both the shoulders, because I said pain in my shoulders. It could be my way of saying that, I've got pain in my shoulders, or one shoulder. You have to ask, and then you have to ask them any other joint. I don't think you particularly said you like it was very vague. And then apart from that, anywhere else it goes, you said that. Anywhere, anything that makes it worse or makes it better, you said that. You did the pain score good. Then you were supposed to like come to your empathy. I don't think there was any empathy in the beginning. You just said that, are you okay to talk with me? Right. And I don't think you gave any empathy in the beginning. Did you, Dr. Umar? I'm not sure.
Well, yeah, because no, I think I'm like my tone was not up and down. It's the same tone. But I think in our start, I asked how you are coping with this. I think we are giving empathy, or sometime if we
So
give
yeah,
the support.
that's right. That's right. But that is your history taking, right? That we're asking them that how you are, because I said that it's been there for 3 months, and it seems like a chronic problem. So you're going to ask them how you're coping with it. So we're going to ask them actually 5 questions: that what is this? What is the impact of it on your life? Is it affecting your mobility? Is it affecting your, like what you do for your job? Is it affecting your mood? How is it affecting your job? Things like that, right? Just in the beginning.
Yeah.
That is part of the history taken, but like empathy, that just starts in the beginning, that I'm sorry to hear that, must be difficult for you to cope up with it. First you should say, like, those. So the IPS was a little here and there. Then apart from that, you did ask about fever. Did you ask about fever? I don't think you asked about fever, because
No,
if
I
you had
didn't
asked,
ask.
so if you had, because you were also going for reactive arthritis, if I'm not wrong. You were
Yeah,
also thinking, if you were asking about, uh, uh, you know, uh, uh, cannot pee,
uh,
like, they couldn't pee, if there was
yeah.
any difficulty in passing urine. So if you had asked about fever, right, then it might have got excluded, no, that they cannot pee, they cannot see, they cannot bend the knee, right? So fever is also like really important. So this person did not have fever. And trauma, very important, I guess, to ask about trauma in the
Uh,
rheumatology.
trauma.
And yeah, trauma. And then you could exclude like one more. If you wanted to exclude here, you could also exclude what? If it's both shoulders, both hips, you can also exclude osteoporosis, because even though he's a guy, he could have it, or
But like
osteoarthritis.
if uh, 40 years, we can ask about osteoporosis.
In a 40 years old, this is a 24 years old, by the way.
20, yeah, yeah, sorry, 24-year
No,
osteoporosis.
you're
It
very
will
right.
happen.
They are old. So yeah, you're very right. I'm sorry. No, don't ask them. Just ask them about, like this arthritis, septic arthritis, and PMR, and maybe GCA, and you were excluding that for sure. Then, I did say I was tired. When I said I was tired, you were supposed to take history of tiredness, right? Like all of the history, and just like keeping the history short. Then asking them about, if you've had any other condition before, right? You could say, have you ever been diagnosed with any long-term conditions, right? Like you could say, are you like, first it's an open-ended question. Then if they say don't, then you can say, all right, any hypertension, any diabetes, then you can just like list those things in one go. And then past medical history also like that. Then you did ask about diet. Did you ask about diet?
No, I didn't ask about that because I
No.
have less time, so I skipped that one.
Yeah. Yeah, and like I know we've got 4 minutes for this, and IPS was like, like I guess it was a little confusing. Maybe that's a reason. Otherwise, the rest of it was good. In examination, you're supposed to, do the vitals, and also you didn't ask for rheumatic fever. Sorry, rheumatic factor, right? Rheumatic factor. X-ray of the joint is important, right? So
Yeah.
some of the blood investigations, and then the image investigations. And then when you give provisional diagnosis, first explain them that it's autoimmune, right, separately. Then just say that it's a referred pain of joints and muscles, right? So that is your polymyalgia, because it says myalgia. So, the muscles are also there. So, you could just explain, like when you see, even though it says, that the 2 minutes are over, don't rush. Because if you rush, then you break your repo building, right? Because even though it says 2 minutes remain, and you have to still make your way to pass it, and you have to still, like keep up with your repo building, right? Like don't destroy it at the end by just rushing. No need to rush. You could still be calm, try and explain it to them, and make sure that they understand. That's the main thing, right? That they understand. The patient satisfaction is the main thing. If they are satisfied, then maybe the examiner is going to be happy and be like, all right, he needs more marks, and I'm going to give them marks, right? And definitely going to involve your seniors, and then like put them on steroids. You're going to tell them that, we're going to put you on steroids for at least 2 years, and the side effects of it, ceftinetin. But again, like history taken. So that, I guess, should be a little shorter, in my opinion.
Yeah, like I feel like the same. Thank you for your feedback.
Okay. Anybody else wants to put in an input on Dr. Umar's performance, or anybody else wants to do these stations? Because we've got many, I guess 7 to 8 stations we can do. Anybody wants to do next, so that we can, move on with it? or if anybody wants to be my patient, I could be the doctor. We're just doing rheumatology today.
Can I be the patient?
Yeah, sure. But let me just confirm if anybody else wants to play the role of the doctor. If not, then you can be the patient for sure. But it's rheumatology, right? So,
Yeah.
okay. Okay, I don't think anybody's interested. So whenever you are ready, we can start.
So,
Do you want me to keep the age and the name and everything the same, the situation the same?
you want us to change the scenario or the different?
No, it's up to you. You're going to be the patient, right?
Yeah.
You know the case. I don't.
Okay. 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 I'm giving you the patient. The scenario.
Yes. So just 1 minute. Dr. Sana is saying, I just want to share when he said to patient that I can understand must be hard. Can we say it the other way? It must be distressful for you to cope up with this pain, right? It must be difficult. There's so many words for that. All right. Yes, Dr. Omar, whenever you want, we can start, but just tell me, is the scenario same or we have a different person?
Like we have a different person that, like in GP practice, patient is in GP practice.
Okay, GP practice. Age?
Age 34-year-old. Sarah.
Sorry? 34?
34. Yeah.
34. Okay. Name?
Sarah.
Sarah. All right, that's the commonest name for any scenarios. Okay.
Yeah.
So just give me a minute. Just a minute. Anybody can note the timer because I don't want to do the timer. If I do the timer, then there is no part of there is no thing for me practicing, right? Anybody wants to note the timer?
I can do the timer.
Hi, Dr. Nihal,
But
how are you doing?
I'm fine, doctor. I can do the timer, but I don't have the official bill. Like I will tell you when it's 2 minutes,
Just
and
tell
then
me
when
when
it's
the 2
10.
minutes are. Like we're up to the 2 minutes mark. That's it.
Okay. Okay.
Yep.
Let me just set the time, and then I will tell you to start.
Thank you so much.
Okay. Whenever you start talking, I will start counting the time.
Okay. All right. I think I can start. Good morning. This is Dr. Hafsa. I'm one of the junior doctors here in the GP clinic. Is this Sarah?
Yeah, doctor. I'm Sarah, 34-year-old.
All right, Sarah. So how may I help you today?
Doctor, I have a pain in my wrist from around about 1 month, and before it was low, but now I got irritated because it's impacting my day-to-day life now. So that's why I'm here.
Okay, all right. So Sarah, can you tell me a little bit more about this pain?
Actually, doctor, it started like gradually, and now with the time, I thought maybe due to it will resolve it soon. I took paracetamol, but now paracetamol is not working on me, and now it's it's very difficult for me to do household things and.
Okay, all right, Sarah. I'm sure it must be very difficult, as you said, it's affecting your life. So, Sarah, you said you have pain in your wrist. Which wrist?
Doctor, it's my right wrist.
Right wrist. And any other wrist? The other wrist is fine?
No, no, doctor.
Both of them have pain?
No, doctor, it's only on my right wrist.
Okay. Anywhere else in the body do you have pain? Or any other
No,
joint?
doctor.
All right.
No, doctor.
Okay, and you said that it's affecting your daily activity. Sarah, is it all right for me to confirm? You said it's been there for 2 months, right?
Yeah, doctor.
Okay, and has this been affecting your mood lately?
Yeah, definitely, doctor. I can't able to do my household things like cooking because I got the pains. Definitely, it's affecting my mood.
And what is it that you do, Sarah?
I can't get to you, doctor. What you said?
What is it that you do?
Not exactly,
I mean,
doctor.
what do you, are you working somewhere? Do you do any job, or you work? Are you
I'm
work?
not Yeah, doctor, I'm working. I'm cashier. I'm working in one supermarket.
All right, you're working in a supermarket. All right, all right, all right. Okay. So, Sarah, you said that it's been there for 2 months, and does this pain go anywhere else apart from this
Uh,
wrist?
no, doctor, it's going in my hand, doctor.
In your hand. And is there anything that makes it worse?
Yeah, doctor, on moving, whenever I'm moving my hand, my wrist or my hand, that is getting worse.
Okay, whenever you're moving it, all right. And is there anything that you've tried that makes it better? Because it's been there for
Yeah,
two
doctor,
months. You tried something.
I told you I paracetamol before it was working, but now it's not affecting on me.
No, it's not working. All right. And on a scale of 1 to 10, 1 being the least and 10 being the most, what would you grade this pain as?
Doctor, it's average. You can say 5.
Okay, it's 5. And apart from that, Sarah, is there anything else uh, that you might want to add to this?
Doctor, I have a numbness also. Now I feel a numbness in my hand also. That's why I'm a bit more worried, and I came to you.
So your hand's been numb now, right?
Yeah.
Okay, all right. And how long has that been for?
Like I am experiencing this from last 2 weeks, doctor.
All right, from last 2 weeks. And had you noticed anything that brought this on? Anything that happened?
No, doctor. Like after the delivery of my child, I thought it's more now.
Okay, it's more now. All right. And have you ever had this before?
No, doctor. This is the first time I got it.
Right, okay. And are you having any fever with this?
No, doctor.
Any loss of weight?
Not exactly, doctor.
Any change in appetite?
No, doctor.
Okay, any weight loss, unintentional weight loss?
No, doctor. I already told you.
Okay, all right, all right. And any problems in the urine?
No, doctor.
Okay, all right, okay. And apart from that, Sarah, is there anything that you've been diagnosed with, like any medical condition that you've been diagnosed with chronically?
Um, yeah, doctor. I diagnosed with diabetes, and I'm taking insulin, and I'm quite regular to my GP.
That is good. And you've been taking insulin as it's been told by your GP?
Yeah, doctor.
Okay. Apart from that, any other medical condition?
No, doctor.
Any medication you take for anything apart from
No,
that
doctor.
insulin?
No,
Okay.
doctor.
I'm gonna ask a little bit about your diet and your exercise, a little bit about your lifestyle, right, Sarah? So, Sarah, what is your diet like?
It's my diet is healthy, doctor. I used to eat healthy.
And do you smoke?
Yes, doctor. I smoke, but I quit when I got pregnant.
And when did you quit? I'm sorry, I couldn't catch that.
Actually, doctor, like when I got pregnant, and then that time I quit. Now my son is 1 year, 1 month old.
Okay, all right. And so, Sarah, did you sustain any trauma, etc.? Like, do you remember?
Not exactly, doctor.
Okay. And do you take alcohol, Sarah?
No, doctor.
And is there anyone in
6
your
minutes.
family? Right. Okay, Sarah. So anybody in your family who's been having this condition?
No, doctor.
Okay, so Sarah, if it's all right with you, I'd like to examine you. I'd be examining your wrists, I'll be taking your vitals, and I'd also be checking your, along with that, I'll also be checking your blood markers, right? Like ESR, CRP, rheumatic fever, rheumatic factor, and an X-ray. Would that be all right?
Yeah, sure, doctor.
Anything there?
Nothing.
Nothing? Okay. All right, Sarah. So thank you so much for letting me examine you and answering all my questions. Sarah, is there anything that you're expecting, and do you have any idea of what it might be?
No, doctor. I was a bit worried. I have no idea what's going on.
All right, Sarah. At the moment, I mean, all the blood results came normal, and you said that you had pain in your wrist and just one wrist, and that you work as a cashier. It could be that, because, and you said that your hand was numb. So at the moment, I'm not very sure what's happening, but I'm going to involve my senior and we're going to work this out. You don't have to worry. I'd be prescribing you. I hope you're with me here, Sarah. Are you following me?
Yeah, sure, doctor.
And so, Sarah, so we're going to involve my senior. We're going to see what's happening. And I'd be prescribing you some painkillers so that we could, relieve your pain. And then we might be involving a rheumatologist to see what's happening, maybe a physiotherapist. It could be a number of things, right? It could be that because of the overactivity as you were working as a cashier, it could be because of that, right? And
Time's up.
time's up. What is it?
Mhm.
What do you
This is
have?
a carpal tunnel syndrome.
Carpal tunnel syndrome.
I give you
Carpal
so
syndrome.
bread.
Yeah, you did. You did. I just forgot the name of the disease. And everything else is fine. The CRP, etc., is not going to be there. And when I examined your wrist, you didn't give me any signs.
No, you have to mention about the specific test. Then I will give you the sign. This blend test.
Alright. Okay. I didn't know that. I'm
She
just
told
beginning.
that she's working in a superstore. So
Yeah,
that's why she might be using her hands too much.
Yeah,
You know,
that's true.
these and mothers, it's very common.
Okay, I didn't know that. So critics, apart from the diagnosis, what else? You're gonna fail me in this station, right?
No, it's not like this. It was good. You started good. You asked about like which wrist that was good. And you spend more time on that one. And then after that, you have to exclude like in our DDs, you ask about the trauma late after you ask about the meftosa, and then you will ask about the trauma. Other thing is good. Then you will. These are a few things we can ask because whenever we are suspecting carpal tunnel syndrome, the risk factors are you will ask about any weakness and wasting in the muscles of the like the hand. This is the main thing we can ask here. Another thing is that she is female, so you will ask about the pregnancy because this is one of the risk factor here. We can ask. And other is smoking is one of the risk factor. So this is
And
this
you said
thing.
that you quit just before like your pregnancy. You're very right. It was a straightforward class case, but I didn't have it in my head, and I totally forgot the name of that thing.
Okay. Another thing is that here we can ask about the BMI because the overweight is also of.
Yes. So how do you ask about the BMI here?
You can say when you will ask about the examination, you can check I will do the observation and we will do the weight against height.
Okay, weight against height. All right. And if I don't say the names of the tests, they wouldn't give me any information about it, right?
This is Fallon test. If you will say that we will do some specific test, then I think examiner will give you the findings.
Okay, but if I just say that I'm going to examine your wrist, then he's not going to say nothing, right?
Guys, I have a question. Should we say CRP and ESR? Should we explain this to the patient, or we just saying infection markers or something?
So better to say Parker. No need to say CRP and ESR because the patient is like layman, so he don't understand these things. So better to be more easier way. We will say like inflammatory markers.
All right, and anything else?
That's it. And then I think you don't know the diagnosis. Then we will go for this one management. In this one management, there is a conservative management and the medication. So we'll go the step-by-step approach. We will give first the conservative management, in which we will give the painkillers, and after that we will give the splint. Mostly we will ask the patient to apply at the night time for 4 weeks, and also we can refer this patient to physical. And if it not resolved, then we might refer to the rheumatologist. And so other is in medication, the steroid injection. We will give steroid injection to reduce the soreness in the joint, or the last option is surgery, which we call decompression surgery. And in the safety netting, we can say that if you have a worsening of pain or the wasting of the your muscles of hand, come back to us.
Okay. All right. Thank you so much, Dr. I didn't know this and I totally got blank. But you're right, and I haven't practiced, so I didn't know this. However, anybody else who wants to be the doctor, because Dr. Umar would be the patient, would that be all right? Or anybody else who wants to practice, be the patient or the doctor, whatever works out. Or I could be the patient, that's okay. I like being the patient more than doctor.
Hi, I can be the doctor.
Dr. Nehal, would you want to be the patient for Dr. Javeria?
Okay, no problem. Yeah, I can be the patient.
Okay. So I'm going to start the timer whenever you guys are ready. And
Okay, the same info of the patient, and he has having pain. Talk to the patient and assess him.
okay, so Dr. Javeria, the patient is in GP clinic. She's 34 years old, and her name is Sarah. All right.
All right.
Okay, whenever you're ready, Dr. Javeria, Dr. Nehal.
Okay, I'm ready.
Yeah,
So whenever she's ready.
yeah, I'm
Okay.
ready. Hello.
Hello, doctor.
Hello, I'm Juveria, one of the junior doctors in this GP clinic. May I confirm your name and age, please?
Yes, I'm Sarah Adams, and I'm 34 years old. You can just call me Sarah.
Okay, Sarah, nice to meet you. And how can I help you today?
Well, doctor, I am having this pain in my hand. It's been going for a while now, for about 3 months, and actually it's getting worse. So I'm really getting worried about it. I work as a secretary, and I use the typing a lot. So it's kind of affecting my job too.
All right, I'm really sorry to hear about your pain. And you mentioned you had this pain in the hand, and for how long you've been having this pain?
Yeah, as I told the doctors, about for 3 or 4 months now.
3 or 4 months, okay. So which hand is it? May I know?
It's the right hand, but I'm
Okay.
suspecting that my left hand has started to hurt the same way.
All right. May I know the site of the pain? Like, is it in the palm of the hand, back of the hand? Where exactly
No,
is it?
doctor, it's my fingers actually. You know, on those like joints, I'm pointing to metacarbopharyngeal and into the proximal interpharyngeal joints.
All right. Yes. So you mentioned that you're having pain in the fingers.
Yeah.
All right. And does anything makes it better?
Well, doctor, actually, the pain is worse in the morning, and you know, it has to. I have to like wait a while until the pain goes away when I try to move my fingers bit by bit, or wash my hands with warm water.
All right. All right. And does anything makes it better?
I have tried actually to take paracetamol. It didn't help much.
All right. All right. And on the scale of 1 to 10, 1 being the least and 10 being the highest, what would you score the pain?
I would say 5 or 6.
All right, all right. Don't worry, we are here to help you. Okay, a few more questions. And is there any pain in the joints?
Yeah, doctor. I told you it's in the joints, like
Okay.
the ones they are moving my fingers.
All right, all right. And does it become stiff?
Yeah, in the morning it become
Is
a
there any
bit
stiff?
stiff.
Okay.
Yeah, in the morning. Yeah.
All right, all right. And is it the first time you've been experiencing these kind of symptoms?
Yes, doctor. It's the first time in my life I've had this pain and this difficulty in moving my fingers.
All right. Any problem with your vision at all?
No,
And any problem with your urine?
no.
All right, all right. And have you been diagnosed with any medical conditions?
Well, doctor, no, nothing. Nothing that matters.
All right. And are you taking any medications at the moment?
No, apart the paracetamol I have tried for the pain, I'm not taking anything.
All right. And are you allergic to anything?
No, doctor, not that I know of.
All right. And is there any condition that run in your family?
What type of condition? Because like my father
Any
and mother are
joint
older.
related conditions? Any joint related conditions?
Yeah, doctor. My mother has something called rheumatoid. I think something like that.
All right. How is she doing now? How is she managing?
Well, actually, doctor, she has started having this deformity in her hands, and uh, am I having the same condition? Am I going to be like her?
All right, all right. And I'm really sorry to hear about your mother. I hope she will be fine. But don't worry, I will get to that point. Okay, few more questions. Bear with me. All right.
Of course.
Yeah, and some questions regarding to your lifestyle. Do you smoke?
Well, but yeah, I smoke, but it's not like every day. It's only the weekends with my friends, maybe 1 or 2 cigarettes. That's it.
All right. And do you drink alcohol?
Occasionally.
All right. And do you manage to do any physical activity?
Well, I was trying, I have always been trying to walk like every couple of days, but nothing more than that.
All right, all right. So at this point, thank you for answering my question, Sarah. So at this point of time, I would like to examine you. I would take your observations, including temperature, blood pressure, heart rate, and your respiratory rate. And also, I would like to examine your hands. Would that be okay
Hello?
with you? Hello?
Okay, have you mentioned any investigations? Because the voice broke down.
All right, all right. And also, I would like to run few initial investigations, including your ESR and inflammatory markers and CRP. Would that be okay with you?
2 minutes remaining.
Of course,
Yeah.
doctor, yeah.
Yeah.
Inflammatory markers are elevated.
All right. All right, Sarah. So, having listened to you and having examined you, as you mentioned that your mother has this rheumatoid arthritis, and as per your symptom, like you mentioned that you have pain, stiffness. All right. So I suspect that you're having condition called rheumatoid arthritis.
So just like my mother.
Yeah, so the family history is linked to this kind of condition. So, do you have any idea about it?
Well, just what I have seen with her, she's in pain and she had this deformity in her hand.
Yeah,
I'm really worried. Am I going to reach this point?
yeah, but don't worry, you have come at the right time, and we are going to help you. So basically, it's an autoimmune condition. This means your immune system attacks your own joints by mistake. I mean, and this makes the joint very painful and stiff. Are you following me?
Yes, doctor.
Yeah. So would you like to know the treatment options? Okay.
Of course, doctor. Yeah, please.
Yeah. So firstly, we will give you the supportive treatments. We'll provide with the supportive treatments, including physiotherapy and occupational therapy. And for the pain, we will also give you some painkillers. All right. All right, and there are also some medications called disease modifying rheumatoid arthritic drugs. All right, so I will also involve my seniors. I will have a word with them and discuss your case with them. All right. Do you have any more concerns? Okay. Okay, it's done.
I think time's up. Yeah.
Yeah, sure. Okay.
No, Dr. Neil's going to give
Sorry, Dr. Hafsa. Yeah. Well, you have started a very good start, actually. You asked about everything, and I think you caught it early. But I would have, if I don't know if it's the sound or what, but some info I just gave it to you in the beginning, and you asked about it again, like for how long, and if I have like pain in any joints. If you meant any other joints in my
Yeah.
body, you should have said that, because I, as a patient, my intention is focused on my hands, because this is where my problem is. Second thing is, you didn't ask me about my concern, so I had to tell you about it. And in the management, you didn't like address my concern when I told you, is it my mother's? And I was afraid to get, you didn't really, until I asked you again. So it would have been nicer if you just, addressed it on your own. And I am working as a type, as secretary. So this too has been must be addressed. But I know that, because you heard that 2-minute pill, and when we reach this point, sometimes you just want to say whatever you are, what's in your mind. So sometimes you miss things. And you didn't mention steroids at all. And I think there are more important to mention, other than disease modifying drugs. In my opinion, I don't know if it's correct or not. But overall, I think you were doing fine. You would need maybe just pay some attention to the patient and just make your time more organized, and you'll be fine.
All right, thank you.
Yeah, I guess that's the only thing I also want to say, that after NSAIDs like steroids, and then the PPIs with steroids and aspirin, and then maybe future referral to rheumatologist, physiotherapist, occupational therapist, and if she's a smoker, then management of that. And was she a smoker? I don't know. And then like talking about the patient's mother at the very moment, because if you just address it then and there, because she was just saying that I don't know if I'm going to end up like my mother, and you could just say, all right, I'm sorry that you would feel this way, but don't worry, we're here to help you out, and we'll make sure that everything goes fine. Instead of saying that we're going to come back to that, how about we just say it there, that don't worry, we're here, we'll make sure that everything goes fine, and that even if you end up like that, we'd be here to support you throughout, because it will just save your time. Even at the end, you're going to say and give them some empathy of the sort. So why don't just give it at that time? That's my opinion, though. Dr. Nazik is here.
Hello, salam alaikum. Hello, everybody.
Hello, Dr. Nazik. Walaikum salam.
How
Were you
everything?
observing?
Sorry?
Were you observing? Or you just joined it?
No, I just joined.
All right, we're doing rheumatology. So
Yeah.
if anybody else is interested, Dr. Nair, you wanted to be the doctor, right?
Can I comment on this?
Yeah, I can try.
Yeah, Dr. Umar, please go ahead.
Okay,
Yeah.
if anyone else can be I have no problem with that. So
Okay.
No,
Yeah,
I
no,
just
Dr.
wanna.
Something, yeah.
It was good because she covered everything. And I just remember, in like every chronic condition, we ask impact on the life and mood. This is very important because it will add up in our IPS also. So we will ask these two things here. And the third thing is that like in management, like we have to refer this patient to rheumatologist, and rheumatologist will confirm the diagnosis and give this DMARD. So we have to mention this thing. I think doctor didn't mention this thing.
Yeah, like you cannot give them DMRDs, neither your senior can, even if they're in the GPRX in emergency, only the rheumatologist can. We can give them NSAIDs, we can give them painkillers, right? I guess that's how.
And another thing is that here in rheumatoid arthritis, we can give only short course of steroids. And also we can involve like 3 domains. We can refer it to the rheumatology, we can refer it to the physiotherapist, and also we may involve occupational therapist if there is a involvement, if she can't cope up with her condition or like day-to-day life, or we can involve occupational therapists. So these 3 things we can mention.
Yes, it's right, very, very on point. So anybody else wants to practice? Dr. Nehal wants to be the doctor. Whoever wants to be the patient, they can be. And then we just take turns. We got to do more of these, sessions. Anybody wants to be the patient, Dr. Nehal?
I can be the patient.
All right. You choose it, right? But something that's not been done. Yeah.
Yeah.
Same scenario, same patient, same everything.
Uh, yeah, same patient, same age, same name, and
In the GP clinic.
pain. Yeah, in the GP clinic, and she came with the pain
Okay.
in the thumb. Okay.
Oh, all right.
In the thumb. Okay.
Yeah.
Okay.
Whenever you guys are ready. Whenever you guys are ready.
Well, I am ready.
Okay. Okay, so 1, 2, 3. Let's begin.
Nihal Yusuf, 1, 2, 3, 4, 5, 6, 7, 8. Hello.
Hello, doctor.
Hello, I am Dr. Nihal Yusuf. I'm one of the doctors here in the practice today. Can you please confirm to me your name and age?
I'm Sarah, doctor. I'm 35 years old.
Thank you for confirming that, Sarah. So how can I help you today?
Yeah, doctor, basically I came here because I have this bad pain in the base of my thumb, in lower part of my thumb. I don't know what's wrong with my, so yeah, it's disturbing me a lot, yeah.
Okay, so can you tell me more about it?
Yeah, doctor, this thumb, like I'm not able to move, and it's very sharp pain. Yeah.
And for how long have you been experiencing such pain?
Yeah, since 2 months I've been experiencing this kind of pain.
And are you able to score it to me from 0 to 10, 10 being the highest pain?
Maybe 5, doctor.
Oh, it sounds like a quite severe pain. Have you been coping with it in the past 2 months?
Yeah, doctor, it's been affecting me. Yeah, because and I also have a baby. So yeah, I got recently delivered 2 months back. Yeah.
Oh, I'm so sorry that you're going through this, and congratulations on your baby. I hope you both are doing fine. So have you tried anything to relieve this pain?
Yeah, doctor, I took paracetamol, but it's not helping me.
But can you think of anything that might make it worse by any chance?
Yeah, like whenever I hold the baby, like it's making me more pain.
Okay, and can you do you notice any redness or hotness or swelling around the affected area?
Yeah, it's little bit swollen, doctor, but I don't see any redness.
And can you tell me which hand is it? Is it the right hand or your left hand?
It's my left hand, doctor.
And are you left-handed?
No, doctor, I'm right-handed.
Okay, and so the other hand is free.
Yeah, doctor, it's free.
Okay, and do you have any other symptoms rather than pain in this joint anywhere else in your body?
No, doctor, just pain, and yeah, due to this pain, it's affecting my baby. And as I mentioned that I recently delivered, I'm a little bit tired. I'm not getting much sleep. So yeah.
Well, I can imagine how difficult this period must have been for you. So do you have any main concerns that I want me to address today?
Yeah, doctor, I want this pain to go away. Yeah, because it's affecting me and I can't cook, I can't do any kind of activities. Yeah.
Okay, I'll do my best, of course, to help you out. So by any chance, Sarah, have you experienced any type of fever in the past few weeks?
No, doctor, it's not fever. It's just because I'm getting tired because I'm not getting enough sleep. Like I am waking in the middle of the night to feed my baby. So yeah, that's the main thing.
And I have been, noticing from what you have just told me that you might be a bit distressed regarding what's happening to you. So how does this affect your mood in general?
Mood is okay, doctor. Nothing problem with my mood.
Okay, I'm glad to hear that. So is there any other problems in other joints of your body or any problems with your vision, things like that?
No, doctor, no.
Okay, I'm glad to hear that. So do you have any history of any joint problems or any immune-related diseases?
No, doctor, no, doctor.
And are you on any medication other than the paracetamol you have tried?
No, doctor, no. I am taking that pregnant care for the postpartum thing, but apart from that, I'm not taking anything.
Okay, good. And do you have any family history of any similar problems or any joint-related diseases in your family?
No, doctor. My mother has diabetes, but yeah.
Just a quick couple questions about your lifestyle. Do you smoke or by any chance?
No, doctor, I don't smoke.
Okay, and what about alcohol?
Occasionally, doctor.
Okay, thank you for answering all my questions. Now I'll be examining your hand. I'll be checking your observation, your temperature, blood pressure, oxygen saturation, pulse rate, and respiratory rate. I'll be doing some blood tests for some inflammatory markers, ESR, CTV, things like that. Is it okay with you?
All right, doctor, all right.
Okay.
Mm.
Okay, I'll do some tests called Flingstein test.
Uh-huh. Yeah.
Okay.
Okay, doctor. Yeah, it's
Okay.
positive. Yeah.
Okay. Well, thank you, Sarah, for bearing up with me until now. The good thing is all your examination, all your test results have become negative for anything. So your health is very well. But the test I have been doing to you during your thumb made me suspect that you are having some manageable condition that usually happens to people like you who just had birth or were pregnant. It's called the tenosynovitis. Have you ever heard about this before?
No, doctor, is it a serious condition? Will my thumb
No,
be okay?
as I told you, it's a quietly manageable condition. It's very common. It's just because of your overuse of your hand and your thumb, because of course, you have been handling your baby a lot in last couple of months. This overuse had, affected your joints of your thumb. Are you following me?
All right, doctor. So what can be done now?
Well, first of all, I'll be helping you with the pain. I want you to continue on your paracetamol, but just limit it for 4 tablets per day, just to be able to control the pain. Is it okay with you?
Yeah, but I'm having paracetamol already, doctor.
Because you are, breastfeeding, I cannot give you something per mouth other than paracetamol, but I can offer you some gel NSAIDs to put it on your affected joint, and it can help you with the inflammation and the pain. Does this sound doable for you?
Oh, okay. So you mean to apply on the thumb?
Yeah.
Time's up.
Okay. I was just going to go tell you to rest your hand, but I don't have time.
Yeah, you did good. You need to mention about the splint, like.
Yeah, that was my next, move.
Yeah, that is one thing. But overall, it was good. Yeah, you addressed all the concerns. Basically, it's due to tendons, like inflammation of the tendons that move the thumb, like as they run through the wrist. So yeah, irritation or inflammation of the tendons, you can mention that. And overuse is also a cause. in the treatment part, the splint was an option and painkillers. Yeah. And if it does, if the splint and painkillers, if it doesn't subside, then there is a surgery also. I don't know much about it. I think we need to find out.
I
can
would
do
have told her to. I just, refer her to a specialist who can like assist further. Just to be able to get off the hook.
Yeah.
Thank
Dr.
you,
Nail,
doctor.
you did really, really good. You did really, really good. You addressed everything. I guess you did ask about the psychosocial, you asked about the concern, you excluded some stuff out, you did the flaws. It was flawless.
Thank you,
It was
doctor.
good.
But I
It
had
was really, really
to
good.
practice the time management more. Yeah, but I
Yeah,
always
no,
struggle in
you
rheumatology
did
with
good.
time
I guess
management.
no. You completed your history at around 5 minutes. 5 minutes, 5 minutes, because it was around 5:30 or so when you were about to do the examination. Sorry, apart from that, I guess you did good. And obviously it takes time because you are in a virtual setting. Apart from that, I guess it's good.
And also we can also mention about physiotherapy, some exercises, some kind of exercises, and and in the management there is also like in local steroid injections. I don't know how far it's true. I mean, when we can give that, but this is also one of
I mean,
the
she could just
treatment
refer, and
options.
rest of the thing is are to be done by them because we're in the GP clinic. So maybe painkillers and maybe splint and the rest of the things by the rheumatologist, occupational therapist. But she doesn't do anything. Would we be involving occupational therapists here? Because we'd definitely be talking to the rheumatologist and the physiotherapist. Would you be involving occupational physiotherapist? No? Occupational therapist?
Actually,
No,
I
right?
don't think so because occupational therapist is usually, concerned about the setting, like, yeah, the home. I wanted to ask her, and I forgot. I wanted to ask her about any form of support if she's having someone her in house to help her out with a baby, but this slipped my mind. And this can be like another solution, to offer her to rest her hands, put her in a splint, and ask people to help with the baby so she can gain her like recovery, things like that.
Yeah, and do we need to mention the full diagnosis? Like it's like dequerments or stenosynovitis, or just stenosynovitis is fine.
I actually always struggle with the name of the the
Yeah,
scientist, so I just omit it because I don't want to pronounce it wrong. I mean, he knows now.
But
I
that's
know
a
the
clever thing.
case.
You could say sinusitis. That's right.
Yeah,
Because if you
I know
say
it's the case. Yeah.
but if you can say it, good. If
Hello.
not, don't get in trouble. Hello, Dr. Nazik.
Yeah, how are you, Dr. Hafsa? A long time. Yes, very nice, Dr. Nihal. Well done. Yeah, it's very well organized, structured, full history. Yeah, I like it. But I think you did not ask about trauma, which is very important. Did you ask about trauma?
No, I didn't.
And
Yeah, you shared.
the other thing also we have to ask about her job. Did you ask about her job? Maybe she has a repetitive overuse of the tendon. Maybe she's typing
Well,
too much or
she told
typing.
me she told me she has been taking care of her child day and night
Yeah,
overall the past
but
10 years
but
because
that
she just
doesn't
gave birth.
it did not exclude this. Maybe she's a working mom also. Yeah, maybe she had another risk factor. But yes, pregnancy, you ask because of taking care of a small baby. Another thing also on the examination, shall we mention the test or shall we say to the patient, I would like to do the test and then I will prescribe for her, just put your finger on the palm and then close your hand. I don't know, I'm asking.
I don't
Mention?
think we have time. I don't think we have time for this in 8 minutes. I don't know.
But
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 also, I'm not, also, I don't know.
you know,
Shall we
yeah,
mention the test, the name
because
of the test?
because in other stations, for example, in
Mm.
meningitis and things like that, there's Brodansky test. It's like and in back
Yes.
pain you have
the
straight
patient
leg
wouldn't give you
raising
the
test.
positive response to it, right? The examiner would. And if we just say, no, I'm going to do the
Yeah,
Finkelstein
yeah.
test, or I'm going to do the Fellin's test along in the examination, then the examiner would tell us whether it's positive or not. So, better not tell the patient just during the examination, take the name, because then they'll know we know the pain
Yeah.
and we're almost making the
It's gonna be
diagnosis.
like, yeah, a waste of time if you want it. And if it's more than one test and you are going to explain each and every one of them, it's gonna like end your time.
Yeah.
Don't as long as not an examination station, I guess.
Yeah, that's true, Dr. Neil. Dr. Umar wants to say something. Yes, Dr. Umar.
Yeah, it was really good, and I tried to find mistake, but I failed. And
I was
secondly
looking for
thing is
that
that I just wanted to add up here. Just add up for your knowledge, because one of my friend, she got this station. So here, like the patient concern was that how long she has to wear that splint. So for tenosynovitis, we have she has to wear for 24/7. Okay, for carpal tunnel syndrome, she has to wear only in the night. This is the important thing we know. And secondly, her second concern is because her concern, she can't drive because of this pain. She can't move the steering. So we can say that it will resolve usually 2 to 3 weeks. We can say like this to the to. These are the two things. I just wanted to add up.
No, that's good. Really wanted to know that. I'm just making my own stations.
So
Yeah. All right. Anybody else wants to do this, be the doctor or the patient? Because we've got more. Anybody at all who wants to be the doctor or the patient, or I can go again. I have not studied.
Well,
or like we are studying.
I can be the patient again if anyone
All right.
else.
Anybody else wants to be the doctor? Or anybody at all? Because we're practicing. No? Are you guys sure? Okay. Dr. Nazik, do you wanna be the doctor?
No, not now. I'm just for today, I just, I'm just
Just
watching
recovered?
today. Yeah,
How are you
just
doing that?
recovering.
How are you
I'm still in
doing?
quarantine.
Oh, really?
Tomorrow will be my next BCR, inshallah.
Okay, I hope it's
Much
negative.
better. I don't
I hope
think.
it's negative. No, I hope it is. No, inshallah. I hope
Inshallah. Thank you, sister.
I hope your tests are negative and the people around are positive. And your results are positive for your exams. Not for the COVID test. I hope so. Inshallah. Right. So Dr. Neil wants to be the patient. Who wants to be the doctor? If nobody else is going, I'd go. It's an open mic. No? Okay. Dr. Neil, whenever you're ready, we can start. Can somebody note the timer?
Okay, I will just change the setting a bit. It's gonna be he's going to in the GB clinic, 34. Okay, let's make it 34-year-old James Adam.
What?
He's a male. He's a male. James Adam. James Adam, for example. Yeah, any male.
Okay, male, and he is GP 34, right?
Yeah.
Okay, all right, Dr. Nahal. Can anybody note the time? Anybody who wants to know the time? Because if I do it, then it defies the whole thing.
Well, I'm afraid I can do it for you, but it means that I have to stop in the middle to tell you it's 6 minutes.
Dr. Umar, Dr. Nazik, anybody else?
Yeah, I can.
All right, thank you.
Yeah, I can do it. You can.
Okay.
When you will get
whenever
ready.
You say. Okay, whenever you say, we can begin.
Okay. Ready. Start.
All right. Good morning. Good morning. This is Dr. Hafsa, one of the junior doctors here in the GP clinic. Is this James Adams?
Yes, doctor. Yes. Please help me out.
Oh, all right, James. You seem in pain. Is everything okay?
Yeah, doctor. My thumb, it's hurting me a lot. I don't know what's happened. I cannot move it anywhere.
All right, James. All right. Can you just confirm your age for me, James? And is it all right if I call you James?
Of course, doctor. I'm 34 years old.
All right, James. So which thumb exactly?
It's my right hand, and I'm right-handed, so it's difficult for me now not being able to move my thumb or do anything with my right hand.
Okay, all right. Can you tell me a little bit more about this? I'm really sorry that you're going through this, but can you tell me a little bit more about this?
Well, doctor, it's very severe pain. It started 3 days ago. I thought it's gonna go away. I thought I hit my finger or something. I don't know what happened. But now it's getting even worse, and I can't even move it. I'm afraid if it's broken or something like that.
All right, and James, and why do you think it's broken?
I don't know, maybe because it's painful and I can't move it. I don't recall
Okay.
that I hit it somewhere, but I don't know, maybe.
All right, James. Don't worry, I'm really here for you, and I'd make sure that you get rid of the pain. Is it all right if we continue to chat and get to know a little bit more about your pain?
Yeah, I can manage, doctor. Go ahead.
That is great. That is great. Thank you so much, James. So, James, you've got pain in your thumb, right?
Yeah, doctor.
All right. And is it just that thumb, any other joint of the body is also
No,
involved?
it's just my right thumb.
Just your right thumb. I'm sorry, you are in a lot of pain, James. All right. And you say it's been there for 3 days. And that is there anything that makes it worse, James?
It's painful all the time, so I really can't think of anything that make it worse.
Okay.
Maybe when I
All the
move
time.
it.
All right. When you move it, it's more painful. All right.
Yeah.
And James, okay. And anything that you've tried to make this better? Because you said it's been there for 3 days. Did you try something that made it better?
Well, I have tried paracetamol, but it didn't work. I have tried hot water, things like that. It didn't work.
Oh, I'm really sorry to hear that you tried and didn't work out. All right, James. And can you score this pain for me on a scale of 1 to 10, 10 being the worst and 1 being the least?
Well, about 7 or 8.
That is really bad. Would you want me to continue this conversation or would you want some painkillers?
No, doctor, I can handle it.
All right, that is great. Thank you
But
so
please make
much.
it quick.
Yeah, I'm going to make sure that it's really quick for you. Well, James, is there any problem in your vision? I mean, are you all right? Can you look at things? Any visual problems?
Yeah, doctor, I'm totally well, I'm fine. I don't have any other things.
All right. Any problem in the urine?
No, nothing at all.
And are you running any fever?
No,
Okay. And did you by any chance hurt yourself? Because you said that you didn't, but do you remember hurting yourself or anything that
no,
triggered that?
I really tried hard to recall if something like that happened, but I didn't. Couldn't find
And
anything.
what is it that you do for work, James?
I'm a taxi driver.
You're a taxi driver. All right, James. And
And
have you ever
actually,
had
it's
this before?
affecting my work.
Okay, it's
No, I
affecting.
didn't.
Okay, so for the past 3 days, it's been affecting your work, and it's been difficult for you to do that.
Yeah,
I'm sorry to
of
hear
course,
that.
I can't
And this,
handle the steering wheel, and I can't even, use um, anything in the car. So I've been at home like for 3 days now.
okay, all right. And have you ever had this before?
No, it's the first time.
All right. And anybody else in your, or do you have any other medical conditions that I should be aware of?
No.
Okay, all right. And are you taking any medication of any sort? Long term?
No.
Okay. And may I ask you a little bit about your lifestyle? James, do you smoke?
Oh yeah, I smoke. I smoke about like, I don't know, 10 cigarettes per day for the last 15 years.
All right. Okay. I see. That is a lot. All right. And okay, don't worry. And do you take alcohol?
Occasionally.
Occasionally. All right. And how about your diet? What is it that you eat in a day? What do you like eating?
Well, I think I eat well. I eat a lot of meat and yeah, I don't like eating vegetables. Yeah, if you want to ask me, but I
All
eat
right.
well.
Okay. So by eating well, you mean that you eat a lot of red meat. Is that right?
Yeah.
Okay. And do you exercise, James, at all?
Well, doctor, I work all day long, so I don't really have time for that.
All right. And are you allergic to anything?
No.
Okay. Any family history of any condition related to joints or anything that I should be aware of?
Well, I really can recall. Well, my father died when I was very young, but I really can remember that he was having this pain in his foot, and he wasn't able to walk like for days, and then he become well, and it keeps coming and going.
All right, I'm really sorry to hear that. That must be difficult for you to watch looking at your father in this way. All right, James, thank you
6
so
minutes.
much. Thank you so much for letting me, like answering all my questions. I'd want to examine you and maybe do some blood tests. Would that be all right with you?
Of course, doctor.
Yeah, I'd be examining your vitals. I'd be checking your joints. I'd be going through your blood initial inflammation markers such as CRP, ESR, and along with that, I'd get an X-ray of your thumb. Would that be okay?
Oh, yeah, okay. Do you want to do anything else, or shall I go?
Anything
Okay.
positive? No.
Yeah, inflammatory markers are elevated, and you have like reaction in the joint. You can see like.
All right, James. Thank you so much for bearing with me, even though you've had a lot of pain. So, James, I've done your examination. I've heard what you had to say, and I've got the results of your, inflammation marker. It turns out those are little rays. And since you have pain in your thumb, and since you've been smoking, and like for a long time, and that you're working, and it's affecting your lifestyle, what I'm thinking is that you might be having a condition called gout. Have you ever heard of that, James?
Not really, doctor. What is it?
Well, it is something really common that can affect people of your age. It is where there is some inflammation in the joint, right, in the thumb area. This is why it's been so painful for the past 3 years, and it's been very unbearable for you. And it can be recurrent as well. Are you following me, James, so far?
Okay, doctor. So it can happen again?
Yeah, it can happen if you do not take care of the things that we're going to discuss in a bit about. Right?
Okay,
are you following me?
So yeah, doctor. So it's not broken, it's just inflammation, and there's something to be done about it. So please tell me, how can
8 minutes.
Okay,
8 minutes.
The time's up.
The
time's up.
Yeah, if you want to go on.
Okay, but that defies it. Okay, if you want, we can, but that just defies the whole.
Okay.
You can take 1 minute.
You want me to take 1 minute? All right, 1 minute sounds good. Let's see if I can push this straight. All right.
Go ahead.
All right. Okay, thank you. Well, James, so what we can do is I'm going to enroll my senior, and after that, we're going to start you first on painkillers such as NSAIDs and colchicine. I hope you're following me. That would reduce your pain, right? And there are some things that you can do to stop this thing from occurring more. And if it doesn't work out, then we'd be referring you to a rheumatologist in the future. Are you following me, James, so far?
Yeah, doctor. So what can I do to prevent this from happening again?
The first thing is that you need to rest. And since you're not taking alcohol, so that's good, like you're an occasional drinker, but you've been smoking, right? And one of the reasons that this pain might recur is smoking. So we need to work on that. Do you want to hear the ways through which we can help you with that?
Well, doctor, I'm really not interested in that right now. Is there anything else that I can do, like, besides cutting smoking? Like, I want to know all my options.
Yeah, that's true, James, that you've been smoking and you don't want to hear about it. But here's the thing, that, you had this pain and you're going to have it again. And I told you that one of the reasons that you had this pain is you're smoking. So if you are ever interested in knowing about that, please let me know. Apart from that, what we can do is we can, ask you not to put pressure on it, right? And improve your lifestyle a little, right? And however, whenever you're ready to talk about smoking, we can go for that. And if it recurs, we'd be sending you to a rheumatologist, right? And one more thing that you need to look out for, James, is fever. If you ever get fever, if it doesn't relieve, if it happens again, you're supposed to visit us soon, right?
Okay, doctor. Okay. Thank you very much.
I did bad at the management part, I know. So
you didn't mention the diet. I wanted you to save time talking about smoking cessation. Yeah, to go to the diet.
I forgot diet. Why do you eat red meat? It's yuck. Don't eat that. Yeah, I forgot about the diet.
Yeah,
So
I wanted
important.
you to save yourself some time, but you didn't give the hint. Okay, I have tried my
Oh,
part.
stop smoking. Stop smoking. Stop. You're very right, Dr.
Yeah,
Nair.
because if I told you yes, you'll go through like we can give you like nicotine patches and like refer you to a smoking cessation clinic. It's gonna eat your time up,
That's true. That's true. So I didn't say you should go there. I just said whenever you're ready, we can talk about it. If he's not interested in knowing, I'm like, all right, I don't want to give you any
Yeah.
options. You can say.
And I was telling you, okay, I'm not interested in this now. Is there any other options for me? Like I want to know my options. Like, okay, try, not to eat a lot of meat, maybe because like
I
that.
told you God, you're a meat eater. Vegetarians here. I'm sorry. You're very right. I should be focused. I wasn't focused. True. That's true. Anything else?
Well, Dr. Hafsa, I know exactly what wasted your time. It's recapping. You recap a lot and you signpost a lot.
Yeah, that's
I
true.
used to do that. It was my problem, my big problem. I used to recap everything and you use very long sentences and, signposting and things like that. And it turned out it eats a lot of time, even if you didn't notice. So I just made a pact with myself not to signpost except in two like situations. If I'm going to ask about something a bit sensitive like sexual life, or if I'm going to change like the direction of the conversation to something else, like lifestyle. So those are the only two like situations I signpost. Other than that, no, at all. I don't do it. And I don't recap. I just, if I needed to, it's gonna be like 2 or 3 words. Like I have had this for 3 months, so something like that. More, for example, I'm just giving an example here. It doesn't apply to this case, but if someone has a pain or have a pain for 3 months, then you can like, well, 3 months longer very looks like a very long time. So how are you coping? How's it affecting you? Things like that. Just no more than like 3 or 4 words. To not waste my time. I think if you try this, you'll find that you'll finish the history faster. And you didn't ask about the joint inflammation. It's a joint and it hurts. So you have to ask about like redness, swelling, hotness, stiffness. Those are, it's like addressing the main complaint and you didn't do it. It's a pain and you moved on.
Yeah,
So,
that's right.
yeah.
That's right.
Mhm.
Yeah, because it was very acute. I should have done it. I didn't. Yes, you're very right.
Yeah. Okay.
Okay.
And that's my and I made it the thumb because if I told you it's a big toe, you would know from the start. So
Yeah,
that's
you're
why I
very right.
changed
So I
it.
was like, okay. Yeah, that's good. I
Yeah.
mean, it could be the thumb, right? The body wants to affect whatever it wants. Yeah.
Any joint. Most commonly it's the thumb. But one thing else, you asked me about the past medical history, and then you skipped asking about my family medical history, and you went to the DESA, and then you went back to my family history. If you ask about my family history at that point, you would have known, because I would tell you about my father,
Yeah, you're right.
But
You're right. That's my fault. I didn't follow the structure correctly.
that's all my comments. And I think, yeah,
Okay.
that's
Thank you
it.
so much, Dr.
And you
Nair.
didn't tell me it's
Thanks for
because,
being
you didn't tell me about the cases. It's because eating a lot of red meat, it increases my uric acid or something like that.
forgot to
You missed this part.
I forgot to eat.
So it's like, yeah, just more elaboration about what I have actually, because I left with, it's just an inflammation in my joint and that's it. And you told me to quit smoking, and this is what all doctors say, so I won't listen to you. You know what I mean? You just have to make it like, yeah, that's it. That's my comment. I'm sorry if I took too long.
No, you were saying all the right things. I really need that. Nobody does that. Everybody's like, all right, can we do it? And then they move ahead.
Dr. Hafsa,
Yeah, Dr. Anwar.
can I come in?
Yeah,
there's one thing is that don't offer painkiller because you're on GP surgery. So be practical. You can say, just give me a few minutes. We are here to help you. So don't offer painkillers. Otherwise, if the patient says, okay, give me the painkiller. So how you will manage the situation? So don't, it's my advice I discuss with. Yeah.
I'm very worried
Another
about
thing
this.
is,
When can we offer? Is there any particular time when we can say, all right,
Well, I have heard someone said, I don't really remember who said it, but it made sense to me. After you score the pain and you tell him, ask him about any allergies, ask him if he did take anything, to relieve the pain and how much did he take or whatever. And then you can tell him that I know that you are feeling so, it's painful for you now, but I just want you to cope with me for a bit more. I'll be giving you a suitable painkiller once we finish our conversation, and I will try to make it as quick and as fast as possible. So now,
you're very
this
yeah, you have
this is
a
quite
very
suitable.
good idea. Yeah, you have a good idea about what he had and if he had any allergies. So after your consultation, knowing what he has, you can give him any painkiller that's suitable for his case.
all right. That sounds good. All right. Dr. Umar, you were saying something?
Yeah, there's another thing is that have you asked about the medication? Because the medication is very important here, because so many medication also raise the uric acid level. So we will ask about the medication
She
specially.
asked, she asked about that. I didn't I know that it usually comes as an hypertensive patient who is taking thiazide recently, and but I didn't put this in this case because I didn't want her to be so scripted, But you are right.
So you're very right. But she didn't have to. I didn't ask.
And other thing is you have to explore the diet more, because sometimes the sugary drinks also it will cause red meat is there, because and don't assume like this, because your patient didn't told you about the meat, so you have to explore which meat,
Red meat. Didn't you say red meat?
I said I said red meat.
Okay, I heard about only meat, so that's why.
Yeah, I said red meat.
Why red meat? Today is the meat day, right?
Yeah, because I practically give you nothing in this session, so I have to give you a clue.
Dr. Muhammad.
Sorry. Yeah. Go ahead.
Have you checked? Have you asked about the blood investigation uric acid level?
No, I did not ask about the uric acid. You're very right. I didn't ask about uric acid. I didn't ask about vitamins as well, right? I think we can go for vitamins as well, no?
Some antibiotics and
Okay, so you guys can fail me in this presentation. That's all right. Anybody else wants to practice?
No, you're fast.
No, don't say that. We're not choosing that. We are only going to fail each other here, so that we are very, determined to pass. When we do perfect, that's passing. Perfect almost, then it's passing. But if you guys give lots of comments, then we're failed. All right, that's good. However, that is good, right? So that is one thing that we're doing here. Okay. Anybody else wants to practice? Because we got 2, 3, 4 more stations. Anybody at all, or else we just, move on. Dr. Gulsum, Dr. Javeria, Dr. Muhammad, Dr. Nazik, Dr. Punas, Dr. Sana. You guys are bored, right? I think it's been an hour.
Hour and a half, I guess.
Can I be the patient? Hi, doctor.
Yeah, you can be the patient. Yeah, Dr. Punas, you can be the patient. Who wants to be the doctor? I can be the doctor, but if I've just been the doctor, so anybody else who wants to be the doctor? Anybody wants to be the doctor? No? Dr. Umar, Dr. Sana, Dr. Nehal, yeah.
I can be if no one else wants to.
All right, sure thing. So Dr. Nehal and Dr. Punas, all right? I hope I'm taking your name correctly.
Yeah.
Okay, all right, okay. So whenever you guys are ready, I can start.
Okay. It's the same stem, right?
Same stem. Okay. James Adams, patient name, 34 years.
GP setting, right?
GP setting. Okay.
Okay. Whenever you guys want.
I'm ready. Nihal Yusuf, 1, 2, 3, 4, 5, 7, 6, 8. Hello, I'm Dr. Nihal Yusuf. I'm one of the doctors on duty today. Can I confirm your name and age, please?
Hi, doctor. I'm James Adams. I'm 34 years old.
Thank you, James, for confirming this to me. Is it okay to call you James?
Yeah, sure, doctor.
Okay. So how can I help you today?
Doctor, I was working in the garden. Then suddenly there's a pain in my elbow. I don't know what to do. So I took some tablets, but the pain didn't subside. So I came here.
Okay. You told me that the pain in your elbow.
Yeah,
So which elbow are we talking about?
that's right elbow.
Okay. And what about your left one? Is it okay?
It's okay, doctor. I
And
have
by
problem
any
in the
chance,
right.
while working in your garden, have you
Yeah.
sustained any trauma to this elbow?
No. Just I am working in the garden. Then it started suddenly. I didn't got any trauma.
Mhm. Well, can you please score the pain for me from 1 to 10, 10 being the highest pain?
I think it's 5 or 6.
Oh, it's quite alarming. So, are you comfortable talking to me right now?
Yeah, doctor. Sure, I'm comfortable.
Okay, I'll try to make it as quick as I can. So you told me
Okay.
took some tablets for the pain. Can you tell me what have you exactly taken for it?
Paracetamol, doctor.
Paracetamol.
Yeah.
And how many tablets have you taken?
500 mg, 2 tablets.
Okay. Is there anything else that you find that help with the pain or didn't you?
No. Nothing else.
Okay. Can you tell me if there's something making the pain worse?
Uh, when I'm folding my arms, the pain gets increased.
I see.
Yeah.
Okay. And do you notice any swelling or redness or hotness over the joint that is affected?
No, doctor.
Mhm. Okay. And since how many hours have you been experiencing this pain now?
Like 4 or 5 years, doctor.
Okay. Okay, just a quick question about your general health. So have you noticed any fever the past few days?
No, doctor. No.
Okay. And have you had any problems in your vision?
No.
Any problems in urination?
No.
Okay. And can you tell me what are you doing for work, James?
Actually, I'm accountant, doctor. I usually go to work. I work there in the office, and in the even in the weekends I work in the garden. Since today is a weekend, I work in the garden, and I got this. Usually, I work
Mhm,
in the office, like writing works, taking
mhm,
files from here to there. That's kind of work.
mhm, mhm. So I can see that this injury might affect your work too. Am I right?
Yes, doctor.
Mhm. So can you tell me if you have any other problems or symptoms that you are having beside this pain?
Uh, I had a rash in the left side.
Sorry, you had what?
Rash.
Rash.
Yeah,
Okay, and
left side of the
where,
abdomen.
where exactly this rash is?
Left side of my tummy.
Okay, and can you describe it to me?
I think it's very long time back. Um, I think some 2 or 3 months it was there. It's like brownish color.
Okay, and have you sought any medical help regarding this rash?
Um, I didn't take any medicines because it doesn't give me any problem to me.
Okay. Um, Okay. So other than that, do you have any other,
No,
problems?
no problem, no problems. That's it.
Okay. And regarding your chronic, the chronic diseases, have you ever diagnosed with any chronic or joint diseases before?
No, doctor, no.
Okay. And are you on any medications other than paracetamol you just took?
No, not specifically.
Okay. Any family history of any similar situation or joint problems?
My mom is diabetic and my father is hypertensive. Other than that, I don't think there's much family problems in my family.
Okay, thank you for answering my question. So regarding your lifestyle, do you usually practice any form of exercise?
Uh, I usually I try to exercise, but since my work, I can't do exercise.
Well, I see. Okay, what about smoking? Are you a smoker?
No, doctor.
Do you drink alcohol?
Yeah, when I move to parties with my friends, I usually drink.
Okay, and what about your diet? Can you walk me through your diet?
Yeah, I take veggies and non-veg, everything,
So it's
fruits. Yeah,
okay, good. So it's balanced diet, all right?
yeah, mixed.
Okay, thank you for answering all my questions, James. So now I'll be
O-
examining you.
Okay,
I'll be checking all of your observations, your blood pressure, temperature, heart rate, respiratory rate,
okay,
and pulse rate. And I will be checking your the elbow that you are having your problem with. I'll be doing
yeah,
some tests,
okay.
a test called Croson test and Mills
Mm-hmm,
test. I'll also be doing some
mm-hmm,
an imaging or X-ray to the elbow to make sure that everything is okay.
mm-hmm.
I will be running some tests like inflammatory markers in your blood test. And is it okay with you?
Okay, doctor.
Okay. Any findings, doctor?
Yeah.
Any
What you
findings?
asked? What you asked, doctor? Findings.
Yeah.
What findings, doctor? What you're speaking about?
Because I made some tests, so is it positive or negative?
Aha, okay,
Any
okay.
right
Yeah, it's
findings?
positive. Yeah, positive.
Okay. Well, thank you for bearing up with me, James, until now.
Okay,
From my examination and what you have told me, and from our test, well,
okay,
I suspect that you have something called tennis elbow.
okay.
In medical term, it's called lateral epicondylitis. Are you familiar with this condition?
No, doctor.
Okay, so I can tell you all about it. Sometimes when you overuse your elbow or your wrist,
Time's up, but you can take 1 more minute.
okay, thank you, doctor.
Okay,
Sometimes when you
okay,
overuse your elbow or your wrist,
okay, doctor.
you are experiencing this type of pain and tenderness on the outside of your elbow. Are you
Okay.
following me?
Yeah, doctor.
Okay, and this pain usually affecting your grip and affecting your arm movement, as you told me.
Yeah.
So I have many, ways to handle this.
Okay.
So do you want to discuss me how to relieve your pain first, or
Sure, doctor. Sure.
okay? So I can give you some painkillers. I will
Okay,
give you some insights that can
okay.
make sure that everything is controlled with the pain. I will ask for something called nerve conduction
Is
study,
that
just to make sure. Okay,
is the
go ahead.
painkillers is the painkiller itself is enough, doctor?
Well, of course not. Actually, you have to rest your injured arm and stop using
Okay,
it for a while
Mm-hmm,
and limit the movement
mm-hmm,
just to make sure that everything is going to recover well. I'll also ask you to put some cold compress over it to help with
mm-hmm.
the pain. Are you following me?
Yeah, doctor. Sure.
I just want to ask you, we will do some further tests It's called
Uh-huh.
nerve conduction study, just to make sure that you haven't injured any nerves that are passing through this area.
Uh-huh. Okay, doctor.
Okay. I will be following you up after a couple of weeks to make sure that everything is okay with you.
Okay, doctor.
This is good for you. So if you at any chance felt that you're not improving, or if you feel that pain had become more severe, or you developed any fever, limitation of your movement of the elbow, just
Okay.
come to us as soon as possible.
Sure, doctor.
Then maybe that I will look at you and maybe refer you to a rheumatologist or orthopedics to make sure that everything is okay with you.
More than 2 minutes now. Yeah.
Okay, thank you, doctor.
Uh-huh.
No.
Thank you, doctor. You asked right when in the middle, like that examination. No, I don't know. I have to tell it like positive. I'm. This is my first consultation, plab2 preparation. You know, this
It's
is
okay,
my
doctor,
first.
no problem. No problem
Yeah,
at all.
this is my.
You did great.
So
Actually, you did
yeah,
great. So I know,
yeah.
yeah,
Okay.
just you have just, when some you tell you about the examination, so you just give them because
Uh-huh.
the examiner in the exam gives you like the findings. So you just, give him the findings
Yeah,
and
yeah.
they
Okay,
can go
okay.
on.
I never practiced, right, so I don't know that. Year after I will catch that. I'll do that with the practice.
Just a few weeks.
So
Just a few weeks.
yeah, yeah. I'm
So
yeah,
you'll get there.
I'm stuck in the middle because I don't understand. Maybe that's a drama. I think within the consultation. Maybe
No,
I
no, no,
don't know
no,
that.
no, no, no at all, doctor. It's totally
Yeah.
fine. Thank you
Okay.
for
Okay.
being my patient.
Thank you, doctor.
Okay.
Any comments on what Dr. Neil did? Do you have any comments on what you did?
Can I give comments?
Yeah, definitely.
Of course. What do you think I made wrong, or do you have any advice?
Uh, I think we have to finish it in 4 minutes. I think in
I'm sorry.
We're all trying to do that. That's why we're
the
here.
history.
That's why we're
Since
here.
since it's my first consultation, I'm getting a bit confused. Yeah. I watched this Dr. Yemo Sobi's videos. So he said like we have to complete the first domain within 4 minutes and the second domain in four minutes, I think. So yeah, we will
We're
try.
trying, Doctor.
We'll
We're
try
doing
to
what we
complete
can.
within 4 minutes in the exam. When we are in the
Hopefully.
exam, at least.
Hopefully.
Okay.
Hopefully.
Okay, thank
I
you,
think
doctor.
that you didn't mention the radiating. So can I add some more comments to
Of
my
course.
knowledge?
Yeah,
Uh,
go ahead.
I don't think you asked for the like aggravating factors, activating what is getting worse. I don't think you asked for that. Um,
Uh, well, I asked you, is it worse with the movement? And you told me, or something like that. I don't really remember.
okay. Yeah, maybe.
And I told you if
Uh,
you tried anything else beside the paracetamol that might help, and you tell me no, I guess. I don't really remember what I said.
yeah, okay. Yeah. I think that's a good consultation for me.
Thank you, doctor.
Yeah, that's a good consultation. Um,
Anybody else wants to say something? Thank you, Dr. Punas
thank you,
and
thank
Dr.
you, thank
Neil.
you.
Dr. Nazik says you did very well, address the patient concern. You're a hard worker, Dr. Nehal. There you are.
Yeah, she
Showing.
warmed my heart.
Mashallah.
She warmed my heart, actually. Thank you, Dr. Nazik.
You're
Thank you very much.
welcome. Okay. Anybody else want to practice? If not, then we would end this and maybe do back pain tomorrow. How about that? Same time?
Okay.
Should we do that? All right. So tomorrow, inshallah, same time, we're going to do back pain. Right?
Okay.
And then after that, maybe tiredness, hopefully. Thank you so much, everyone. And if anybody's
Thank you, Dr.
interested in
Hafsa. Thank
practicing,
you, doctors.
no worries. If anybody is interested in practicing individually, give me a time, I'd be there. I would want to practice individually, right? Okay. All right. So thank you. I'm just gonna end this and you guys can inbox me.